name is Taryn. Today I'm going to be doing my wound change, my sterile dressing wound change. And I'm going to follow all general safety principal practices. I'm going to provide for biopsy. Then I'm going to do my hand hygiene to start out. Can I get your name and date of birth? Alright. Do you have any allergies? Can I get your pain from like a 0 to 10 scale? Okay, so he says it's at a 4. If it was anything above a 6 due to his care plan, I would always offer pain medication. But he's sitting at a 4, so I won't need to. I will do my 11 medication rights, my 3 checks, and then I will always come back for recess before I would do my bandage. But I don't, like I said, I don't need to. So this is going all the way down. I'm gonna get this back. I'm gonna put this back in between the legs, if that's okay. Making sure I have it a little bit away from that, just so it's not touching and I don't have to worry about any kind of contamination. I put on hand sanitizer, try to keep it clean. Gloves come on. When I'm removing this, I'm going to do the push-pull method. We'll start from this. It's coming off pretty easy, but if it had any trouble coming off, I'd make sure I'd use saline to soften the adhesive. Fold this. On this, I'm looking for a type amount, color, and odor, and everything looks pretty normal with what I'm wanting to see with the wound. Okay, and with that, I'm going to do hand hygiene one more time. I'm going to keep an eye on this. I'm going to do size, appearance, drainage, and pain on it. Did that cause you any extra kind of pain? No, it didn't. Okay, then it's good to proceed. I'm going to be checking my expiration dates and make sure everything's dry on both my gloves and my sterile box. Go ahead and folding this back, having my finger away. Okay, now that's open. That's not sterile, so I need to keep an eye on it, but it needs to be out like in my peripheral. So I'm gonna do my glove over here. My first gloving over here. I can throw this away. I'm gonna go ahead and open this. And open that. Stays down. I have an inch to pull. Okay. I am keeping an eye on that. I'm going to keep an eye on this. I'm going to put my hand sanitizer on. Okay. Now I'm going to pick it up with my opposite hand. Pull this. Put this on. Step back when I put it on. And then I can grab the bottom and help. Okay. Now, for this one, I'm going to use this hand. Put 2 fingers under, put my hand in the bottom. Yep. And then when it's sterile on sterile, I can kind of readjust. Okay, now I can pull this down. Okay, and now I am all sterile, clean. So what I'm going to do is I can pick this up. Keeping my hands up, you always keep your hands up. Go around, start from the middle, work my way down, throw away. Start from the right side, work my way down, throw away. And then start from the left side. And then I'm going to do this way. I'm kind of checking it in there because I don't want to touch the bag for any means. The next step will be getting my tweezers. Okay, middle is what I'm going to start with. So around, middle, around, side. Make sure when I'm coming back, I always come back from the side too. Then round this way. Then this way with it. Gloves are going to come off. These are old, so I'm going to make sure I get this in the bag. Okay. And then I'm going to do my hand hygiene again. Now I am trying to maintain sterile field, and I'm keeping an eye on my wound. So this time I can't do it on this table. The wound's open and it's already been cleaned. So what I can do is I can do this, inform from the side, pull this out, check that. And go ahead and pull this. I still have that inch length, and I am. So I can keep an eye on that because it's still within my peripheral vision. I'm gonna do hand hygiene because you always have to do that before we glove. I'm gonna pick up here. See my thumb's right there. And then I'm gonna back up and make sure that when I put on my glove, I really back up. And then I'm gonna put my 2 fingers in there. And then put them on like this. Okay, now I can fix this with my 2 fingers over here, and then I actually cut on the bandage. So I can pull this, be careful not to really touch the sides. Okay, now I can start putting on my tape. I'm gonna put it on 4 different sections. I'm gonna put that back on the table. I do have a pen in my pocket, so I'm gonna grab my pen. Take another little piece of tape. My sterile field's already covered because I have the bandage on, so I'm gonna let you touch this with the thing. Pen open. I'm gonna do my initials. I'm gonna do the date, and I'm also gonna do the time. I'm gonna make sure I document, and then I'm gonna come back and reassess where I have this tape on this wound. Make sure there's no kind of irritation or he's on any kind of pain. And then I'm gonna put this down. Gloves get removed. Throw away everything that needs to be thrown away. Be very careful pulling this out. Throw this away. This needs to be thrown away, and I clean up my mess.